wanting to have babies, there's one thing you are definitely wanting to know more about and constantly debating. It is C-section deliveries versus a normal vaginal delivery. Now, we are discussing childbirth options here and what suits who the best. Is there a particular method that works for all? But before we get into all the answers, let's get in some crucial data that seems to be throwing a trend of sorts. Now, did you know that a recent IIT Madras study found that the rate of C-section deliveries in India has jumped from 17.2% to 21.5% in just 5 years? In private sector, these numbers stand at 43.1% in 2016 to 49.7% in 2021, meaning there's nearly 1 in 2 deliveries in the private sector currently that are cesarean. In another in-depth analysis, you look at states and you figure out that Tamil Nadu and Chhattisgarh, researchers found that despite Tamil Nadu, actually both of them having high-risk pregnancies, etc., Chhattisgarh did not have many cesareans and Tamil Nadu did. Also basically telling you about medical resources and facilities there. But why are we looking at this comparison? The study actually states that it's a mix of women preferences, social, economic factors, several educational levels as well, all playing a role in what women choose and what doctors' choices are as well.
Okay, let's try to understand this a little better. Let's break it down. A normal delivery or a vaginal birth is the traditional method of childbirth. It's where the baby is born through the birth canal. Now, it generally involves a shorter recovery time, less risk of surgical complications for the mother altogether. On the other hand, a C-section or a cesarean, it's a surgical procedure used to deliver a baby through incisions in the abdomen or the uterus. C-sections can be planned for medical reasons, sometimes even others. We'll discuss those other reasons. They can also occur as an emergency procedure when complications arrive during the process of labor.
Now, to help us navigate through this important discussion, we've got Dr. Rishma, a top gynaecologist in Mumbai from the Leelavati Hospital, who will shed some light on why each of the method might be a difficult choice and a different choice as well for different people. Let's welcome her. Dr. Pai, thanks so much for joining us this morning on the Breakfast Club. First up, the question, let me just hit the nail straight on the head and ask you straight away. Cesarean versus normal delivery, which one do you recommend for whom and why?
Definitely, this is an area, cesarean versus normal delivery, which has been at the center of attention for a long period of time. Particularly now, since the government also released some data that the cesarean section rate has increased from about 17% across India to around 21% in the last 5 years. So there has been a gradual rise in cesarean section deliveries. And I would say, very simple thing, not one size fits all. Every decision about how a mother should deliver is individual, and it is taken with the doctor, with the patient and the family in consultation. That's the ideal situation, because there are many unique situations. So you can never put a stamp and say this patient is perfect for normal delivery and this is patient for cesarean, because it may change at any time during the course of the pregnancy or even during the labor process. So there are some situations, for example, a first-time pregnant patient with a abnormal presentation, like a breech delivery or baby's lying across instead of head down. If a young girl comes in, 26 years old, first-time pregnant, all good, health normal, baby is nicely taken its position at 36 weeks of pregnancy, 9 months of pregnancy, there's no reason why she should have a cesarean section. So it all depends. There are patients who come to me the day they're pregnant, like 1.5 months pregnant, they've just diagnosed pregnancy, and they're like, doctor, we want a normal delivery. There's no way anyone can predict how this pregnancy will progress. So I think there's no number. Let me be very clear. There is no perfect number that 10% of your delivery should be cesarean or 20% should be cesarean. In fact, even World Health Organization had many years ago, they had said that approximately 15% cesarean rate is a good cesarean rate.
Doctor, let's talk about one phenomenon in particular. In a lot of metro cities, in a lot of private hospitals in particular, you're seeing this phenomenon of planned C-sections. Auspicious dates, for example, people will have a muharrat that they want, sometimes, times like 2 a.m., 3 a.m. in the morning, where they want to have a planned cesarean C-section. Just tell us a little bit about your thoughts around that.
Yes, so definitely I'm in agreement with you on the fact that in metros, in private centers, the cesarean section delivery is slightly higher. And this is across the country. And there are many reasons for this. One very, very small percentage is what you have just spoken about, people who plan to have a delivery on a particular date, etc. Usually, many people demand this from us, but it is the group of patients who already need a cesarean section. Like I said, for example, the baby's in an abnormal position, they anyway need a cesarean, then they'll come out with a date and say, okay, this date, this time. Almost everybody does that. But if you're giving them a choice of normal and cesarean, almost nobody will choose that, oh, just because of this date, we want a cesarean. So that's very, very rare. So I wouldn't count this as important. What is important is that in our upper class, well-educated group of people who come to the private hospitals, they are very informed. The patients are very well aware of what is going on. They have read a lot. If I tell them about a particular problem, they will read about it, so they know what it is. And for me particularly, always we will make sort of like a birth plan. We will inform the patient once she's entering a 9th month. This is your situation. These are the pros, these are the cons, these are the risk factors. Would you want to take this small risk which is associated? Then we can go ahead and give you a vaginal delivery. No problems at all. But believe me, it's a shared responsibility. No patient can say, I want a normal delivery 100%. Then if there's a problem, supposing everything is normal, she's laboring for 10 hours, she's in pain, that time the heartbeat of the baby starts to drop. Are you still going to say that I want a normal delivery? No, at that time you have to trust the doctor. So I think a lot of times it is the doctor-patient trust.
You're absolutely right. It has to be a medical decision and it has to be taken by the doctor. And I feel people don't do a birth plan. People don't really talk about this much more as they talk about keeping the baby healthy or talk about keeping the pregnancy healthy as well. But one of the reasons, doctor, why cesareans might be on the rise could be because older women are now having, more and more older women are having kids.
I wouldn't call it 30. 30 is still very much acceptable in today's times because literally, like you said, girls are getting married very late. Hardly anybody's getting married before 28, 30 nowadays. And then nobody wants to have a baby immediately. They are in their careers. They want to travel around. They want to spend time, get to know the family they're married into, and only then will they plan a baby. And I've had many patients who at 35, married for 3-4 years, when I tell them that, are you considering, becoming pregnant, having a baby? They're like, oh, we haven't discussed it yet. So at 35, they're still in the process of planning it, and which is why we have a lot more of infertility. We have a lot more of girls having difficulty in becoming pregnant because at the end of the day, 35 plus for us is an older girl whose egg quality and quantity is going to reduce. So they have definitely delayed pregnancy and childbirth. And older mothers, and I wouldn't say 30, but I would say over 35 if you're pregnant, there's even a higher risk of genetic problems in the baby. Down syndrome risks increase after 35. So definitely more tests are done. We're a little more careful about them. And of course, if they're late 30s and 40s, then it is really becoming a more high-risk pregnancy. So we know that if a girl is pregnant at 40, then it's whether she's going to have any more children or not, we don't even know that. This may be her one and only chance of a pregnancy. Many of these patients have gone through fertility treatments, they've done IVF, various things. And so they become, as it is a high-risk group of patients. So when they're a high-risk group of patients, then they're going to be treated as such, And what other thing has changed is that almost everybody today has either one child or 2 children maximum. So each child, each pregnancy is so precious, so important. There's so much focus on that, that a mistake is not acceptable.
Doctor, before we let you go, we do want to ask you, do you have any tips that you suggest for women in their 30s who want healthy pregnancies, healthy babies too? What are the sort of basic guidelines you say?
I think a lot has to be changed because a woman, like I said, the first important thing is to have the pregnancy and the delivery at the right time. And to me, the right time is really late 20s, very, very early 30s. That would be really the best time to have your babies. Pre pregnancy counseling. Nobody, literally nobody comes for pre-pregnancy counseling. Once they are pregnant, they come in. So either they want the pregnancy or they don't want the pregnancy. They're mentally not ready. Oh, by mistake, we became pregnant. That is all absolutely not necessary. Pre-pregnancy counseling, pre-marriage counseling, that doesn't exist in India. It should be. When you get married, before you get married, come there, show us, do you have thalassemia? Do you have problems? Do you have thyroid? Do you have this? Let us correct everything. Let's put you into perfect health before you become pregnant. Once you're pregnant, then they come with big, big fibroids, which they didn't know they had. They come with thyroid, they come with diabetes, they come with blood pressure. They never knew they had all that because they've never come for a pre-pregnancy test. So whose fault is that? So it's get yourself into the best of health. Go to your doctors. In India, medical care is fairly inexpensive compared to anywhere else in the world and accessible. You can reach a doctor anytime, any place, unlike in the world where you have to take weeks of appointment before you can go to see the doctor. So we are accessible to you. Come to us, get a good pre-marriage or pre-pregnancy consultation. Let's make your health perfect before you plan your baby, and then come for regular checkups through the pregnancy. Go ahead, educate yourself completely. There's so much information online and everywhere else. Be healthy, be fit throughout. Pregnancy is not a disease. It's a part of your normal life. So you can do whatever you wanted to during pregnancy, which you did otherwise. Basic care and basic precautions.
Right. It's good to get a number from a doctor, apart from listening to what advice society will generally throw at you. I think that's a good one there. But can I play devil's advocate here, Dr. Pai, for a second and also say this? As somebody who has recently delivered, it is getting more and more difficult to sort of these days find doctors who will even choose the normal delivery route. Is it because there is a lot of scrutiny, like you said, every pregnancy is precious, and that sort of swayes away doctors to take which could be the easier route, or not easier, perhaps the safer route in way of C-section?
If you say to me that a patient sets up a conversation about having a normal delivery if everything, all factors are fine, I don't think there's a single doctor who will say, no, I will do a cesarean only. Or if you come to me, I will do cesareans. I don't think there's a single doctor who will say that. Yes, situations may change. We may feel till, say, 5 months, 6 months, everything is perfect. And then there's a possibility things may not be perfect. So like I said to you, I don't think there's any doctor who for a normal, healthy patient, no diabetes, no hypertension, not morbidly obese, baby in a good position, everything perfect, why would they advise cesarean? Nobody can do it. And plus, how do we justify ourselves? We can't justify. How do I tell the patient that, you need a cesarean? So if I have to suggest that, I have to justify. And every doctor has to do that, right? Even if the patient is not educated. We get so many patients who are not very highly educated or not from a very high social strata, but even they have questions. Right? So I think everything has to be justified, it has to be explained, it has to be mutually agreed upon, and that is how you can go forward. So whether it's a normal delivery or cesarean really should not make a difference. The doctor's skill is important. In normal also you require a lot of skill. For cesarean also, to do safely you need a lot of skill. Hospital charges may vary a little bit, maybe a little bit, not even that much, because for a normal delivery you normally stay for 2-3 days. For a cesarean you may stay for 3 or 4 days maximum, not even that. Nowadays even with cesarean we send home early. So even hospital deliveries cost is nearly the same, give and take. And doctors usually charge the same. So it's no money attraction either. So it's really not that. Once upon a time, yes, more than 10-15 years ago, doctors would charge more for cesarean and you could blame the doctor. Oh, for the money they're doing it. But most of the time now, that's not the case either.
Okay, that's a really fascinating look behind the scenes, Doctor. Thank you for bringing us the numbers in this last answer, but also giving us all of that context. Now, here on TBC, we love to bring you, our audience's holistic health. So